Good evening. Good evening, all of you. So it's me, Abhilash Vijay Mohan, and I are again here on YouTube. Okay, your virtual platform. Hope all are doing good and fine. Yes, എല്ലാവരും നന്നായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. എല്ലാവരും സന്തോഷമായിട്ടും സുഖമായിട്ടും ആരോഗ്യമായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. യെസ്. ഓക്കെ, അപ്പോൾ നമ്മൾ ഇന്ന് 24th ലൈവ് പ്ലാറ്റ്ഫോം സെഷനിലേക്ക് നമ്മൾ വന്നിരിക്കുകയാണ്. So we'll be having topic discussion and I have got certain hints. Okay, so certain questions were asked to me by some of our students. So they were asking me like reflecting how to reflect verbal cues. Okay, verbal cues in the sense how to reiterate the statements made by the patient. Okay, if the patient is saying something, how to respond back to their verbal statements. So I think I have already discussed it. But again, taking your account, taking your request into consideration, I could suggest you what are all those verbal cues that you can, how to reflect to the verbal cues which is given. Okay, എങ്ങനെയൊക്കെയാണ് നമ്മൾ verbal cuesന് എങ്ങനെ റെസ്പോണ്ട് ചെയ്യാമെന്നുള്ളത് നമുക്ക് കുറച്ച് സ്റ്റേറ്റ്മെന്റ്സ് അതിനെക്കുറിച്ച് പഠിക്കാം. അപ്പോൾ നമ്മുടെ സ്റ്റുഡൻസ് എല്ലാവരും login ചെയ്യുക. I want all of you to watch this. Okay, subscribe this, put your like, get me your suggestions, and I would like to share it to those who are needy, those who are those who are wishing to migrate to their dream destinations, mostly English speaking countries. Okay, അപ്പോൾ എല്ലാവരും ലൈക്ക് ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക, ക്വസ്റ്റ്യൻസ് ഇടുക, സജഷൻസ് ഇടുക. അതേപോലെ എന്താണ് ഇത് നമുക്ക് വേണ്ട OET ആസ്പയറൻസിന് വേണ്ടിയിട്ട് ഇത് ഷെയർ ചെയ്ത് കൊടുക്കുക. ഓക്കെ, നമ്മുടെ 24th സെഷൻ ആണ്. അടുത്ത എപ്പിസോഡ് ആകുമ്പോഴത്തേക്ക് നമ്മളൊരു ഒരു സിൽവർ ജൂബിലി എന്നൊക്കെ പറയുന്ന നമ്മുടെ എന്താണ് ഒരു നമ്മുടെ എപ്പിസോഡ് വെർച്വൽ പ്ലാറ്റ്ഫോം എപ്പിസോഡ് 25th ലൈവ് പ്ലാറ്റ്ഫോമിലേക്ക് പോവുകയാണ്. So thank you all for your support. Okay, so I would like to thank to Roshan, Vipin, and Akash for their immense support for making this session possible. നമ്മുടെ ക്രൂ നമ്മുടെ കൂടെ തന്നെ ഉണ്ട്. അപ്പോൾ അവർക്ക് എല്ലാവർക്കും എൻ്റെ ഒരു ബിഗ് സല്യൂട്ട് ആൻഡ് താങ്ക്സ് ഓൺ ബിഹാഫ് ഓഫ് യു. ഓക്കെ, അപ്പോൾ എല്ലാവരും ഒന്നുകൂടെ സന്തോഷമായിട്ടും സുഖമായിട്ടിരിക്കുന്നു എന്നൊക്കെ ഞാൻ വിചാരിക്കുന്നു. അപ്പോൾ നമുക്ക് എന്ത് ചെയ്യാം? സോ ഹൗ ടു ഹാൻഡിൽ ദിസ് റീട്രേറ്റ് ദോസ് വെർബൽ സ്റ്റേറ്റ്മെന്റ്സ് ഓഫ് ദ പേഷ്യന്റ്. ഇന്റർലോക്യൂട്ട് അല്ലെങ്കിൽ പേഷ്യന്റ് പറയുന്ന എന്തെങ്കിലും വെർബൽ ആയിട്ടുള്ള സ്റ്റേറ്റ്മെന്റിനെ നമുക്ക് എങ്ങനെയാണ് അത് റീട്രേറ്റ് ചെയ്ത് അതിനെ ഒന്ന് അസർട്ടൈൻ ചെയ്തിട്ട് അതെങ്ങനെ നമുക്ക് റെസ്പോണ്ട് ചെയ്യാം. ഹൗ ടു റെസ്പോണ്ട് ടു ദ പേഷ്യന്റ് സ്റ്റേറ്റ്മെന്റ് ഓർ സേയിങ്സ് എങ്ങനെയാണ് നമുക്ക് ചെയ്യേണ്ടത്, എന്തൊക്കെയാണ്. സോ അപ്പൊ നമ്മൾ മിക്കവാറും എന്ത് ചെയ്യാം? We could have a polite you can interpret the patient politely. Okay, so when the patient is communicating, if we want to interfere in that communication, first of all you should learn how to interpret the patient, okay, in a polite way. That is what. Okay, so what is the statement that you can generally do is like, could I just interpret you for a second? Could I just interpret you for a second? Okay, നമുക്കൊന്ന് എന്താണ് ഒന്ന് ഇന്റർപ്രറ്റ് ചെയ്തോട്ടെ എന്നുള്ള നമുക്ക് എന്ത് ചെയ്യാം, നമുക്ക് പേഷ്യന്റ് അടുത്ത് ഒന്ന് പറയാം. ഓക്കെ, could I just interpret you there for a second? Okay, that is what. So when the patient is continuously talking and if you want to confirm something or make sure something, you can just do the statement, fine. And in other ways, if the patient is saying you something and we need to follow that particular statement, what you can say is like, I believe. Okay, I believe that. അല്ലെങ്കിൽ you believe that. Okay, the treatment is of no use. Just like that. Okay, if the patient is expressing his concerns regarding, is expressing concerns on the treatment, what, Mr. Martin, if I'm right in thinking that you believe that, okay, these are the things. Okay, you believe that the treatment is of no use. Okay, likewise, you believe that it sounds like you hate these medications. It sounds like you hate this medication. Okay. You mean. Okay. So for the verbal statements, you can give the word you mean. You won't discharge. Okay. So these are the statements now by which we could fill the space, fill the blanks. Okay. You mean what you believe. Okay. You feel like. Okay. Yes. You're saying that. Okay. Okay. If I'm correct in understanding you, you're saying that, okay, if I understand you correctly, if I heard you correctly, okay, if I understand you correctly, if I heard you correctly, you believe that, okay, or you conveyed that, it seems like, or it sounds like, no, it seems in the sense, we are just responding to some non-verbal cues, seeing their appeal, their emotions, okay, we are interpreting their facial textures or some gestures or actions. Okay, it seems and it looks and all. So it sounds like, that means we are taking some sounds or the sayings of the patient and is responding back. Okay, so these are some statements. to rephrase what you said. Okay, to rephrase what you said. Okay, to rephrase what you said. That means we are just rephrasing the statement made by the patient. Okay, to rephrase what you said, or you mean, it sounds like, you believe that, or you feel that, if I understand you correctly, if I heard you correct. Okay, so these are, you believe that, you feel that, all these are some usual terms that you can use to catch the patient statement and to respond back. Okay, patient നമ്മളോട് could I just interfere, അല്ലെങ്കിൽ could I just interpret you there for a moment or a second? Okay, നമുക്കൊന്ന് ഇടപെടാമോ? So polite way of what we are just interpreting the patient for a second, follow up something. That is what. So these are some statements that you can generally use to express the patient's verbal commands. Okay, to respond back to the patient's verbal commands. Okay, hope you all are getting me. Yes, my dear students, all of you. So I want my friends to give me the screen. Okay, now the question will be displayed. So we'll be going for role play discussion. Okay, so the question will be will be displayed right there on the screen. You can have a look and we'll follow that. Okay, my dear students, the question is displayed right there. Okay, good evening, Mane. Pramod Sharma. Sir, I want to join Be Good for OET preparation, but I have a doubt for your communication language is also Malayalam. Please clear my doubts. Mr. Pramod, I assure you that we'll be providing you the best coaching. Okay, so this is the leading language school. Okay, you need not to fear the communication language, in the sense in which we'll be using Malayalam, but the mode of communication will be English, because it is occupational English test we are imparting. So you don't have to worry about anything. You can firmly join to our institute, and I assure you the best coaching available over the world. Okay, in the language, in the area of language, in the arena of language. Okay, so you don't have to worry. So whatever the doubts you have means, you can just make a call to our admission wing. Okay, so we have got those numbers over there, how to contact our admission wing. Definitely you can come and take the admission, and I assure you all the sort of best coaching from our side. You don't have to worry. So Pramod is there means, please trust him. Okay, you can trust us. Yes, Pramod. Okay. So now itself, if you're having any doubts or any other concerns, you can just ask me here, or my dear students, those who are watching me. Okay, fine. See, there is some, actually, we have noticed some problem in the Facebook live. So I want all of you to just share this YouTube link to. Okay, please suggest it among your friends. I think there is some technical errors has happened. Okay, so now, but the YouTube live is going on. I want all of you to follow that. Okay, all my dear students. Yes, we will come to the role play card. See, the emergency department of a hospital is the setting. Fine. You are a nurse. Hello, Bonnie. Yes. See, yes. Good evening, Mane. Yes. Emergency department of a hospital is the setting. You are a nurse in the emergency department of a hospital. Okay, so our role is described like nurse in the hospital. The patient is 45-year-old person who has sustained many bee stings. while working on beehives on the hobby farm he or she owns. Okay. Patient's hands and ankles are swollen, red and itchy. The patient's breathing is becoming more labored and is becoming agitated. You suspect the patient is going into an anaphylactic shock and there is no time to waste. Okay, yes, try to calm the patient down. So, this is a question where there could be many sorts of confusion or concerns that could happen. So, this is emergency department of a hospital. So now we are dealing with a patient. Now we are dealing with a patient who has come into our hospital following bee stings. Bee stings mean hobby farming in the sense of small scale farming. That is what, not a large scale farming, which is in an aim to produce revenue. Okay, it is not a large scale farming. In order to produce a revenue, it is just like a hobby, just like a time pass. They'll be doing some small area farming. That is called hobby farming. Okay, yes, the patient's hands and ankles are swollen. Okay, red, itchy, all those bee sting symptoms are there. Okay, patient's breathing is becoming more labored. So we are observing labored breathing and is agitated. That means they are in mental, they're mentally very down. Okay, yes, you suspect the patient is going into an anaphylactic shock. Anaphylactic shock means allergic shock. Bee sting means allergy, hypersensitivity could happen and the patient could come to a shock. Okay, and there is no time to waste here. We doesn't have any time to waste. Try to calm the patient down. So in this case, if the patient is approaching us like, oh nurse, please help me, if the patient, so we have already done a topic like that. Now I'm just going to deal this in another way. Just like patient is coming in a if it is a dire emergency condition, the patient comes with a shrill cry, ഒച്ച വെച്ചിട്ട് ഓടി വരികയാണ് patient എങ്കിൽ, oh nurse, please come help me. You can respond like that, please come. Yes, what happened? Please come. Have you? Okay, please lie on this spot. Likewise, are you able to walk? We have just dealt with the topic previously. You can just subscribe to those previous classes that we have done, virtual platform sessions we had. Okay, so now I'm just going to deal in a different way. Okay, in an emergency department, we are just going to deal with the patient. Either of this style of introduction you can take in this topic. Either the patient is approaching, responding to the patient's opinion. If the interlocutor is not saying anything like, oh nurse, please help me. If the interlocutor is not initiating the communication, what is a way by which we could initiate the topic? So I'm going to make you learn the sort of introduction in today's topic. Okay. Respond to the patient's fear of imminent death in a positive way and tell the patient you must administer an epinephrine antihistamine injection immediately. Okay, so the patient would be having a feeling like, because labored breathing and all those sort of manifestations, so all those signs and symptoms would be crushing him like anything. He will be really sick of this condition. He's feeling fear of death. That is what the patient is feeling like. He's about to die. So we need to alleviate that fear, and we should inform them that we are going to give an emergency epinephrine injection. That is an anti-allergic injection we are going to give patient. Okay, so immediately we should do that. Tell the patient that you notice she is becoming less agitated and the swelling is starting to go down. Ask the patient how he or she is going to get home. So in this condition, following that, the third task is saying that patient's all symptoms have come down. That means we need to give a dialogue as if we have administered epinephrine injection. We need to act just like we are doing imitating physical examination. No, here in this topic, in between second and third, you say some communication. You have to speak like as if you have administered an epinephrine injection to the patient, and following that, the patient's symptoms are coming down and the patient is becoming stable. So you should do that. Without that dialogues, we cannot move into third task. Because that is what I told you, no, this question, and there is no doctor interference mentioned here. So as a practitioner nurse, you can just take this communication and continue with the topic. Okay, there is no doctor intervention mentioned in this topic. So as an emergency case, we are just giving the epinephrine injection, and following injection, the patient symptoms are coming down. So you need to formulate the dialogue according to that. ഡോക്ടറിന്റെ ഇന്റർഫിയറൻസ് ഒന്നും ഇവിടെ പറഞ്ഞിട്ടില്ല. അതേപോലെ സെക്കൻഡ് ടാസ്കും തേർഡ് ടാസ്കും തമ്മിൽ എന്താണ് മോനെ, വി നീഡ് ടു ആക്ട്. നിങ്ങൾ ആക്ട് ചെയ്യേണ്ടി വരും. എന്താണ്? ഒരു കമ്മ്യൂണിക്കേഷൻ, അതായത് എപ്പിനെഫ്രിൻ ഇഞ്ചക്ഷൻ കൊടുത്തു എന്നുള്ള രീതിയിൽ ഒരു കമ്മ്യൂണിക്കേഷൻ നിങ്ങൾ കൊടുക്കേണ്ടതായിട്ട് വരും. ഓക്കെ, ആർ യു ഗെറ്റിംഗ് മീ, മൈ ഡിയർ സ്റ്റുഡൻസ്? Yes, as the patients following that, making the patient settle, calm and settle down, we need to ask how they are going to back home. Okay, so regarding their journey back home, Advise the patient you will order a taxi home for both him and the brother. Okay, so the brother would have accompanied him, so we can arrange a taxi because something is happening there. We need to confirm it with patient. Okay, എന്തോ സംഭവിച്ചിട്ടുണ്ട് അപ്പം ബ്രദറിന് ഈ പേഷ്യന്റുമായിട്ട് ഒരു ടാക്സി നമ്മൾ അറേഞ്ച് ചെയ്ത് കൊടുത്തു വിടേണ്ടി വരും. And for the patient to get plenty of rest for the next few hours, applying Benadryl cream, and you have given her. So following this, after reaching home, we can ask them to apply Benadryl cream and ask him to take plenty of rest. Okay, for a few hours. That we need to advise after reaching home how to take care, homely care. Okay, home care following the discharge. Finish the consultation by telling that the patient that if things have not normalized within 12 hours, he or she must see a doctor. We need to finish the consultation because we should conclude we have just administered, we have done all those things, assess the patient situation, we have administered an epinephrine injection. Following that, we are sending them back home. So following our consultation, so when it comes to the end of this consultation, okay, so finishing the consultation, we can ask them, they can go back home. But in case if they observe something unpleasant, they can come to our come to our setting and consult a doctor immediately. Okay, so that's all about the topic. So since the doctor's interference is not mentioned, only on the last task, in midst you can just take your own. You can just continue all those dialogues according to your. Okay, according to your will. That means you are just you yourself administering the epinephrine injection, and you're doing all those things. Yes, my dear students. I hope the question is clear to all my dear students, those who are watching me. Any concerns or queries means you can throw your suggestions over here. Okay, so now the Facebook part is also okay. So those who wish to watch this live session on Facebook platform, they could subscribe that too. They could have a watch on that. So there was a network error there. Okay, so there was some technical errors where it was there. So following that, there was some interference with those Facebook Live. Now, anyone those who wish to join on this live platform on Facebook, they can subscribe that and can watch. Okay. Anyway, YouTube is also going comfortably. My dear students, anyone have any doubts? Means please tell me. I'll be very eager to respond to your doubts. Okay, so without doubts, without interaction, how would it be possible for me to take this session comfortably? For a teacher, always this doubts and your interaction is always welcomed. It's always appreciated. Okay. Yes. So if no one is having any doubt, mates, we'll move into this dialogues. Okay. So first itself, I told you if the interlocutor is not initiating the communication in a condition, oh no, please come help me. If the interlocutor is starting the interview like that or the session like that, you can say like, yes, what happened? Please come have your seat. It's like a dire emergency situation, the usual form of that or natural form of introduction. So in other case, if the interlocutor is staying very calm and in a comfortable manner, just like this, not responding to any of this, not at all having any tendency to initiate the top need the conversation. Okay, nurse should initiate the conversation. So how can you start that? You cannot say good evening or good morning. You can start with a hello. Hello, my name is Abhilash. Okay, so you can say like, hello, my name is Abhilash. So there is an emergency room. The patient is having this trouble. Hello, my name is Abhilash. I'm going to be your emergency nurse. Okay, I'm going to be your emergency nurse here. Okay, what do you prefer to be called? What do you prefer to be called? Okay, so in an emergency way, in an bare natural emergency situation, this one is we are just asking the patient's name like that. Okay, we are just initiating. Hello, my name is Sabilash. I'm going to be your emergency nurse here. I'm going to be your emergency, and like I'm the emergency nurse here. My name is Dash. I'm going to be your emergency nurse. Or you can say like I'm the emergency nurse here. What do you prefer to be called? What do you prefer to be called? Obviously, they will be responding to your question. Okay, you can call me too. You can call me too. Okay, they'll be saying like I'm too. Okay, so this is hello. My name is Abhilash. I'm the emergency nurse here. Like I'm going to be your emergency nurse here. Okay, what do you prefer to be called? What do you prefer to be called? What do you prefer to be called? That is what we are just taking the identity of patient. Okay, so they will be saying that. Oh, well, Mr. Tom, okay. Well, Mr. Tom, I know that you're really sick of this condition. I know. Mr. Tom, I know that you're really sick of this condition. Can you please tell me what has actually happened? If you don't mind, can you tell me how it happened or what has actually happened? Okay, Mr. Tom, I know that you are really okay. You're really sick of this condition. That means the patient is having some trouble. Okay, so I know that you are really in trouble. I know that you're really sick of this condition. Do you mind me telling me how it happened? Do you mind telling me how it happened, or can you please tell me? Okay, can you please tell me what has actually happened or how it happened? So this is the way by which we are moving into the topic. So the patient will be saying like, I cannot tolerate this, nurse. See, I was doing this hobby farming. I got bee stings. Okay. Yes, the patient is uh, expressing his concerns like, I'm going to die, nurse. I had bee stings. That is what after that I'm feeling. Uh, really distressness, I'm about to die. Okay, the patient would be having some sort of concern. I'm sorry to hear that. Mr. Tom, you don't have to worry. You are in hospital. Okay, Mr. Tom, I understand. I'm sorry. I can understand. Okay, I'm sorry. I can understand. Mr. Tom, you don't have to worry. Now you are in hospital. Now you are in hospital. You are safe. We will do the needful. Okay, you are safe. We will do the needful. Okay, so the patient will be saying, like, no, nurse, I'm going to die. I cannot tolerate this anymore, this discomforts. I cannot breathe properly. I'm going to die, nurse. Please help me. Okay. Please relax, feel comfortable. I told you that you are here at safe place. You are in right hands. Okay, we have got emergency medication for your presenting complaints. Okay, I've got an injection for you. I have got an injection for you. Okay, I have got an injection for you. Okay. Okay, there won't be nothing bad happen. Okay, nothing would happen. If the patient is saying like, I'm going to, nothing would happen. You don't have to worry. Okay, please feel comfortable. Nothing would happen. That means the patient is saying that he's about to die. Then we need to arrest that patient's conversation. Nothing would happen. You are safe. You're at right hands. We will do the needful. See, we have got all the facilities here. Emergency medications are here. Now I could suspect allergic reaction. So these are part of the signs and symptoms are suggestive of allergic reaction. These signs and symptoms are suggestive of allergic reaction. So we are just making if the patient is saying that I'm about to die, I'm going to die. No, no, please feel comfortable, relax, feel comfortable, relax, Martin. No, please relax, feel comfortable, Martin. Nothing would happen. So you're in right hands, you're at right hands, you're in safe place. Okay, you're in hospital. We have got all the facility to save you. Okay, we have got all the facilities to save you. Okay, nothing would happen. Okay, we are just assuring the patient's health. Okay, so the signs and symptoms are suggestive of uh, allergic reaction. Okay, the signs and symptoms are suggestive of allergic reaction. Never say like anaphylactic shock because that is a complex medical term. It would be very hard for a common person to follow that. So never you can avoid the term anaphylactic shock. So these signs and symptoms are suggestive of allergic reaction. Okay, so I could confirm the bee stings. So I could confirm the bee stings. Now the first thing I'm going to do is to give you an epinephrine injection. Now, the first thing I'm going to do is to give you an epinephrine injection. Okay, it is an anti-allergic medication which could alleviate all your discomforts, including labored breathing and other difficulties. So this is how we are going to deal with the patient. Okay, I know that you are really in trouble. I know it's troubling you a lot. I know it's troubling you a lot. See, the signs and symptoms are suggestive of allergic reaction. The first thing I'm going to do is I could confirm the presence of bee stings. I could confirm the presence of bee stings. Now, the first thing I'm going to do is to give you an epinephrine injection. Okay, this is an anti-allergic medication which could alleviate all your discomforts, including your breathing difficulty and other difficulties. Okay, breathing difficulty and other discomforts. It could alleviate all your discomforts, including breathing difficulties and other symptoms. Okay, so can I give you the injection? Are you ready for that? Okay, can I give you the injection? Okay, okay, may go ahead. Okay, shall I proceed with the injection? Okay, shall I proceed with the injection administration? Are you ready for that? Are you okay? Okay, so if you are okay means I'll give you the injection now. Okay, so if you're okay or if you're ready means I'll give you the injection now. What do you say? We are just taking the permission. Okay, So if you're okay, if you're ready means I'll, okay, or shall I proceed with the injection procedure? Okay, shall I proceed with the injection procedure? Are you okay? If you're okay, I'll give you the injection now. What do you say? What do you say? The patient will be saying like, no, nurse, I'm, uh, I'm really very worried about this injection, nurse. I'm really afraid of pain and all the discomforts because of this injection. Okay, so what we need, I know why you are saying like this. I can understand why you're feeling like this. It is usual. But now the emergency management available is injection administration. But now the emergency management or the definitive management available is epinephrine injection. It has to be administered with an immediate effect. Okay, it has to be administered immediately. It has to be administered immediately. It has to be administered immediately. We cannot delay this. We cannot help you out of this. Okay, we cannot delay this and we cannot help you out of this. Okay, and don't worry, it won't hurt you at all. You may feel a bit of pricking. You may feel it. Okay, and don't worry, it won't hurt you at all. Okay, and don't worry, it won't hurt you at all. You may feel a bit of pricking. That is what. You may feel a bit of pricking. That's all those discomforts will go away by itself. You take the injection and see what changes does it make. You take the injection and see what changes does it make. So these are some classic dialogues by which we seek the patient's consent. Okay. So the patient will be saying like, okay, then you do nurse. So from the second task, how we are moving to the third task, we need to act as if we have given the injection. So by doing that only, okay, thank you. Thank you for your patient listening, Martin. Thank you for your patient listening, Tom. Now you feel comfortable. Can lie on this cot, feel comfortable. I'm going to give you the injection. Yes, it's done. This is the way you should make the patient and the community aware, the interlocutor aware that you have just given the injection. Okay. Okay. Now you please feel okay. Thank you for your patient listening. Okay. Thank you for your understanding. Thank you for your patient listening, Martin. Okay. Thank you for your patient listening, Tom. I'm just closing the names, missing the names. Okay. Thank you for your patient listening, Martin. Now you feel comfortable. Relax, lie on this cot. Okay. Please feel comfortable. You can lie on this cot. Okay. I'm going to give you the injection. I'm going to give you the injection. Okay, please feel comfortable. I'm going to give you the injection. Yes, it's done. Or you can say like, yes, it's done. It's over. Okay, how do you feel now? Okay, okay. How do you feel now? Do you have any pain or other discomforts? Okay, how do you feel now? Do you have any pain or other discomforts? So following the injection, we are just appreciating the situation. Yes, it's done. It's over. The injection is over. Okay, well, how do you feel now? Do you have any pain or other discomforts? Do you have any pain or other discomforts? So they'll be saying like, no, nurse, I'm not having any discomforts. Okay, so please, okay, please take rest. Okay, feel calm, stay positive, feel calm. Okay, stay relaxed, stay calm. We can ask them to stay relaxed, stay calm. Okay, so now I feel like you're feeling a bit better. Okay, so how do you feel now? Are you feeling a bit better? So that is how we are moving to the third task. See, tell the patient that you notice she's becoming less agitated and the swelling is starting to go down. Okay, so how do you feel now? What do you, okay, what do you think? How do you feel now? Okay, do you have any pain or other discomforts? Patient will be saying like, no, nurse, there are no much discomforts. Just relax, stay calm and see what changes does it make. Now the medication will act strongly. Okay, now the medication will act strongly. Yes, how do you feel now? Are you feeling bit better? So we are just confirming the patient. So how do you feel now? Are you feeling bit better? Okay. Tell me, how do you feel now? Okay. What do you feel now? Are you feeling bit better? See, the swelling has started down. Okay. So see, the swelling is getting down. See, the swelling is getting down. So we are just making the patient aware about their symptoms. See, the swelling is getting down. See, and your breathing has become normal. What do you say? See, the swelling is getting down. See, the swelling is getting down, and your breathing is normal, and your breathing has become quite normal. Okay, what do you say? Are you okay? Are you feeling comfortable now? So the patient will be saying, like, yes, boss, I'm okay. Okay, just continue your rest. Just continue your rest. You can lie here, continue your rest. Within another few minutes, you will be all right. Okay, just continue taking rest. Within another few minutes, you will be okay. Within another few minutes, you will be okay. So we are just asking the patient to wait till then. medication gets acted completely. That is what. Okay. So continue taking rest. You will be all right within another few minutes. Sufficient. He will be responding like, oh, thank you, miss. Thank you, miss. Well, I hope you're all right now. Well, I hope you're all right now. Okay. Following that, well, I hope you're all right now. We cannot wait for seconds and minutes. So we are having only 5 minutes to pack this conversation. Okay. Well, how do you feel now? Hope you have become all right. Okay. Are you all right now? Is there anything bothering you? Is there anything bothering you? Any difficulties or discomforts? The patient will be like known as, yes, tell me who has accompanied you. So now we are just going to start with this normal thing. Okay, tell me who has accompanied you. Who has accompanied you. Okay, so the patient will be saying like, my brother is there. Where is he? Where is he? So he'll be saying like, my brother is waiting outside. So how you're planning to go back? How you're going to how you're going back home? Okay, okay. So how you're going back home? Okay. How have you planned your return? How have you planned your return? How you're going back home? Or yeah, just can just ask like, how have you planned your return? Are you going by a car? Or do you want me to arrange something for you? So the patient will be saying like, nurse, actually we have, my brother drove me here to this emergency department, but he took some uh, tobacco or some marijuana. The patient would be complaining of that. Okay, he was having some marijuana while driving. So I am not confident in going back home with my brother. So the patient is, oh, yes, that's that has to be taken that has to be taken into consideration carefully. Oh yes, I understand. Is it? Or you can just express your that feel like, is it? Okay. So the patient would be saying, "Look, no, no, I'm not confident in going back home with my brother because he had marijuana while driving. The patient's brother had marijuana while driving, so I'm not confident. Uh, so by listening to that comment, we need to respond back. Is it? Oh, that has to be taken care. That has to be taken care. That has to be taken with utmost care. Okay, well, you cannot. I'll never allow you to go back home with your brother. Well, I can't allow you to go back home with your brother. I can't allow you to go back home with your brother. Now, oh, is it? Well, you can't go back home with him. Well, you can't go back home with him. I cannot allow that. Okay, that could be very dangerous. That could be very risky and dangerous. Yeah, just responding to that. I really appreciate your concern. Okay, I really appreciate your concern for both brother for both you and your brother. For both you and your brother, I could arrange a taxi. I could arrange a taxi. Please never allow him to drive. Okay. Please never allow him to drive for another few hours. Please never allow him to drive for another few hours because we are just asking that brother's thing also. Okay, so we are just responding patiently to the patient concern. Okay, so the patient, when the patient expresses his feel like my brother had marijuana, so I'm not ready. You said, oh well, I appreciate your concern. So you are very concerned on your health. I appreciate that. Even I cannot allow you to go back home with your brother. And for you and for both you and your brother, I could arrange a taxi and never allow your brother to drive for a few more hours. Okay, let him take rest. Once after he's out of that effect, once he's out of that effect, he could go for a drive. Okay, so now I could arrange a taxi for both of you. Now I could arrange a taxi for both of you. How does that sound? Does that sound like an acceptable plan? How does that sound? Or you can ask like, does it sound like an acceptable plan? So they will be uh, asking, agree. Oh, no, sure, please do that. Okay, I'll do the needful. Well, are you aware about your home care and other discharge activities? Well, are you aware about your home care and other discharge activities? So they'll be saying like, no, nurse, I'm really very concerned. I don't know how to take care of me after going back home. Please tell me what are all the things I should focus. Surely I will explain it to you. Surely I will explain it to you. There is not much, there is nothing much to bother. Okay. Oh, surely I will explain it to you. It's nothing much to bother. Okay. Can go home and it is a must to take rest. Okay. So if probably you can take rest for the whole. Okay, if possible, you can take rest for the whole day. Have plenty of water. Okay, there will be. I'll give you some prescription. I'll give you certain medications. and Benadryl cream for applying. Okay, I'll give you some medications and Benadryl cream. Benadryl cream for applying. Benadryl cream for applying. So you can take that and can apply this cream so that all your itching and all other discomforts, skin itching, burning, tingling, and all other discomforts will come down. You can apply this Benadryl cream and so that all your skin discomforts, itching, burning, and tingling sensation all would come down. Okay, so take the medicine and continue applying this Benadryl cream. Take plenty of rest and have adequate water, stay hydrated, and get fed well. Okay, so this is what we can give. So, okay, so the patient would be saying, "Thank you, nurse. Thank you so much. I will definitely follow your words." So we can ask like, "Do you have any other queries for me too? Do you have any other queries for me?" Or you can ask like, "Is there anything else that I could help?" Okay. And once again, I would like to appreciate for your timely admission. Okay. Once again, I would like to appreciate for your concern on health because you notice the discomfort and you are here, you came here, and once again, you deserve an appreciation for timely assistance. Okay. So now I would like to appreciate you for your concern on your health and timely admission. You have just done a great thing. So just motivating the patient because of their concern on health, and for this timely admission we are just appreciating so that the patient will get more motivated. Okay, will get more confident and motivated. Okay, so again, so I would like to tell you one thing. I should appreciate you for your concern on health, and again for timely admission. You just deserve a salute. Okay, I really appreciate you for that. The patient will be saying like, "Thank you, nurse." And listen, Mr. Toe. So finally, the conclusion we are. And listen, Mr. Toe. Now, after taking rest, you'll be here under observation for a few more. You'll be here under admission for a few more hours. After that, you can go back home. Okay, you can take rest. You'll be here under observation for a few more minutes. So that you can go back home. And in case if you observe something unpleasant, in case if you observe something unpleasant, okay, in case if you observe something unpleasant, or if the situation again you feel like the situation is getting worsen, okay, if the situation is getting worse, if the symptoms are not coming down, if something is not normal, the symptoms are not coming down, if you observe something unpleasant, any of these things you can use. If you feel something unpleasant, if you feel like the symptoms are not coming down, if there is something abnormal that you observe, never delay, get back to us immediately so that you can have a consultation with the doctor. So that you can have a consultation with the doctor. Okay. And listen, Mr. To, after going home, if you observe something unpleasant, if you're feeling like something is abnormal, or in case if you observe the symptoms are not coming down, or if it get worse, never delay, get back to us immediately so that I could fix an appointment with the doctor so that you can have a consultation with the doctor. Okay. Okay. It is unlikely to happen, but in case if you observe something, never hesitate, come back to us immediately. Okay, that's it. So the patient will be saying like, "Sure, nurse, I'll take." Now you take rest. Okay, now you take rest. Now you take rest, just relax, feel comfortable, take rest. Now you just relax, take rest, feel comfortable. Okay, now you just take rest, feel comfortable, relax. Okay, I will be here around. I will be here around. That means will be just near to the patient side. So anyway, the patient will be there for a few more time. After that, we can just discharge them. Okay, now you take rest. Now you feel comfortable, take rest, relax. Okay, now you feel comfortable, take rest, relax. I will be here around. I will be here around. That means we are assuring our presence with the patient. I will be here around. With that, you can finish. Okay, with that, or by that, you can conclude topic. A more natural way in an emergency department to conclude such an extreme situation. Okay, that's all. Okay, so I want all of you to watch this question because it has got certain properties like no doctor's interference. Only during after discharging, in case if the patient observes something, we are asking them to come back. In case if they observe something unpleasant, അല്ലേ വീട്ടിൽ പോയിട്ട് എന്തെങ്കിലും അൺപ്ലസന്റ് ഉണ്ടെങ്കിൽ വന്നിട്ട് ഡോക്ടറെ കണ്ടാൽ മതി എന്നാണ് നമ്മൾ പറയുന്നത്. ഇല്ല, actually no doctor's interference. We are just acting like a practicing nurse. We are just giving the injection. We are observing the patient and we are allowing the patient to go back home. Okay, so since it is not mentioned, there is no need of cracking those doctors interference in midst. ഒന്നും പറയാത്തത് കാരണം നമ്മൾ അതിൻ്റെ ഇടയ്ക്കൊന്നും ഇന്റർഫിയർ ചെയ്യേണ്ട ആവശ്യമില്ല. We can just deal the task as it is given. Okay, task തന്നിരിക്കുന്നത് പോലെ പറഞ്ഞാൽ മതി. Hope the situation is clear to all my dear students. Thank you for joining this virtual platform session. So next Friday, we'll be having the 25th episode. I want all of you to watch this. I want all of you to make use of this session. So, okay, all these topics are of different nature. Okay, you could learn how to deal with different topics if you have a close watch over all these 24 sessions, 24 different topics. And in the coming sessions also, we will be taking something very different. And I'm sure that that would be very helpful for you for your speaking exam. Okay. So, and put your comments. You can tag your suggestions. You can send me your comments and try to share it among others, those who are needy. All the OET aspirants should make use of this. Okay. Once again, thank you for joining. So, from Be Good side, it's Abhilash Vinayar signing off. Take care. God bless you all.